Welcome to the Thanks Therapy podcast. Before we start, if you are in crisis or need urgent support, please Google the Samaritans and the country in which you live. Help can be found online and via the phone. We also put local and national helpline numbers and links in the show notes and on social media. Don't suffer alone. Things can and will get better. Enjoy the show.
Hi, I'm Hannah Loudon.
And I'm Emma Loudon, and this is our Therapy Appreciation podcast. Thanks, Therapy.
Where we hope to demystify, destigmatise and encourage the appreciation of good and useful therapy. And today we're talking all about the different types of therapy. How do we know what to go for and what not to go for?
Thanks therapy, for doing all you do. Thanks therapy, don't really know if you should go, you should give it a try, it could be good for you.
So, Hannah, before we start, how are you? How are you doing?
You know, I'm okay actually. Thank you for asking.
That's good.
I
No
had a
problem.
I had a swim in the sea today.
Oh,
The
wow.
ocean. That was really nice. I haven't done that in a while.
It is so good for you.
Yeah.
A lot of people do see swimming as a therapeutic process.
I admire them because it was cold as balls. And
Yeah.
I'm not used to it, but I know that people do it as like a breathing, resilience, body reset type experience, which sounds awesome, but I was just
You just
splashing.
like swimming in the sea.
I was just doing splashy.
Our family are big into swimming and sea swimming.
Mm-hmm.
And
Genetic requirement.
yeah. I was always, the thing that happens in our family is you go to the beach and then dad hassles you to go in the water.
Yeah.
Have you been in? Have you been in properly? And properly means
Up to
you've
your
been up to your
shoulders.
shoulders.
Yeah,
So,
yeah.
you know, sometimes I just splash my shoulders to make it look like I'd been in
You'd
properly.
probably be able to tell. I think you'd be able to tell. How are you anyway?
I am good. Thank you for asking. I'm actually particularly feeling very energized at the minute. I have had a lot of things going on. I've enjoyed developing this podcast with you.
Mm-hmm.
That's been really exciting. It's been a new endeavor.
Yes.
I've got a job interview, so I've been preparing for that.
Oh.
All of those intellectual pursuits I really enjoy. Actually, we have had a bit of a disaster in the family in that my youngest child has broken his arm right at the start of the holidays. So that was pretty stressful and very, very unfortunate for him. But he's been really brave about it. And we're getting on with it, really, you know.
Yeah,
So,
sounds like it.
but I always get really enthusiastic when there's nice, good intellectual products happening.
Well, that's funny. Actually, you should mention that because I was chatting to a friend today and they were like, oh, you know, how's your mood? This is a friend who I have like proper kind of quite frank conversations with about like our respective mental healths.
Mm-hmm.
And I was saying like, you know, I actually am doing pretty good. And I think it's because I know I'm starting my master's in September.
Yeah.
And I have something to look forward to because I didn't really have that before. And I think I need intellectual stimulation.
Yes. It is also, it reminds me of thinking about, that's really self-actualization is what we're doing there, isn't it? It's the top of Maslow's
I guess
hierarchy of needs, which we should probably talk about sometime.
I can't believe we haven't talked about that yet.
We're only on episode 2. Give us time. Okay, so let's get to it. We're going to talk about different types of therapy.
Yeah.
We really want these first few episodes to be sort of like introductory, get to know us, and also get to know what we're, you know, trying to get across here. And that includes educating a little bit about different types of therapy. So, Hannah, tell me, have you experienced many different types of therapy in your life?
For someone who bangs on about therapy as much as I do, I actually haven't tried a huge range, nor do I think that would actually be like, you know, that's not a good aim, probably.
No,
you're probably not going to engage. But my experience with therapy began when I was like a teenager, maybe 17. Can't really remember. And I did like straightforward talking therapy. I don't remember anyone being like, you're gonna go to CBT or you're going to psychotherapy. I think it was just like, here's a therapist we found.
Did they use the word counsellor or therapist?
I can't really remember. I think it was a mix of both.
Okay.
I think it was like, depending who I was talking to, I'd be like, oh, I go to counselling. But I remember it as like therapy.
Okay.
So I think I took it pretty seriously. It's quite a serious 17-year-old. And then in university, I went to a few CBD courses like through the university, here and there. And I always just remember completing them and being like, I wish there was more. Is that just the end? I want more. I
It felt insufficient.
It did feel very insufficient. Yeah. And I did, because at the time I didn't know what I was looking for and what would have better suited me, which I now know was trauma-informed therapy or psychotherapy. With my current therapist, who I've been seeing for about like nearly 4 years, we do psychodynamic therapy, which for me has meant engaging with like loads of different techniques. Start off with just talking and like, sitting in a room and crying sort of thing and figuring out what's wrong. And then, branched out into like Santre, art, blah, blah, blah. But we can talk more about that later, I think.
Yeah. So in terms of different types of therapy, I think it's quite a complicated question and not one that we can actually really cover in this episode without feeling like we're being kind of reductionist. But the point of what we're trying to do here is to give people an idea of when they go to look for therapy and they see different terms, what does that actually mean? What can they expect from that? Where do those terms come from? Because, it'd be great if there was like 3 types of therapy or like 14, as I saw in one BuzzFeed article. But there are so many different types of therapy.
Yeah.
Which can make it difficult to explain, So want to talk about some of the common types of therapy that most people are likely to come across if they're going to engage in therapy. So you've had psychodynamic psychotherapy.
Yes. Yeah. That's my main one. I really love it. I don't have any plans to not go. I think I'm just going to go for as long as possible. My understanding of the term psychodynamic is that the therapist borrows, quote unquote, from various disciplines. Like working with the client to see what they respond well to, what kind of techniques help them express themselves better. But that's just as a client that I understand. So, Dr. Emma, correct me if I'm wrong. I think it has its roots in traditional psychoanalysis. Is that
yes? Oh, yes,
true?
Definitely. Yeah, it does indeed.
I was thinking about this when I was kind of like preparing for the episode, and I was like, I just actually don't really know what it is I go and do every week.
No, I think you have a much better idea than most, really.
Well, I like it because the idea of being able to go and not know what the session is going to look like, because sort of maybe 15 minutes into the kind of initial hello, what do you want to do? Like, this is your time is a phrase that's used quite a lot. So I can say, I don't really feel like chatting. I don't really, I'm feeling down and I want to just kind of get out of it a little bit. I can just suggest drawing, or like we've done Santre work, which I have loved and find fascinating. But also, there's no pressure to engage with those techniques. You can just be silent for a session. You can totally disengage, which can be productive in and of itself. So I like it. It feels like nurturing is the word that would come to mind. But I think I'm doing a lot of assuming that our listeners are familiar with a lot of those terms I've just used. So should we clarify?
Yes, I want to make sure that we are explaining things for people who want more information, as well as given some good detail for people who already have an interest in the area, So,
sure.
So obviously psychotherapy originated with the work of Sigmund Freud and a number of other analysts around that time. And we make a distinction between psychoanalysis, which still exists today and is still practiced, but that's super intense and you go like 5 times a week minimum, often you go more times a week. And psychodynamic psychotherapy, which is based on the same teachings but is less intense and focuses on dealing with unhelpful patterns of behaviour, which often have their origin in childhood experiences.
Yeah, I'm interested in the Freud stuff. Am I right in thinking that a lot of that is that the client doesn't look at they don't look at each other? The client lies or reclines.
Yeah,
They're meant
so
to be speaking just into the space, and then the analyst, I don't know, catches your words behind me.
yeah. So the traditional
I'm doing a big
image,
arm here.
yeah, the traditional image of psychoanalysis is the therapist sitting on a chair behind the head of the of the patient, and that was all to do with projection and transference, and trying to remove all barriers to the client's. We would say client now, but they said patient back in the day. They're getting in touch with their unconscious, essentially, you know. That was the idea behind that.
Yeah, that's my understanding of the Freud stuff. I don't know like a huge deal about him. I think in uni I read a few of his things, but I mean, that was ages ago. But at the moment, with my therapist, we've been talking a bit about Carl Jung, who I think is relevant here because he's like one of the big
He was a contemporary of
heavy hitters, mentioned in the same breath as Freud a lot of the time, which probably like another episode.
I think we
should
could
do
definitely
a deep
do
dive
a
into
Freud Jung episode because it would be hilarious among other things. But
like Battle of the Bands.
Yeah.
But I think he's relevant to mention here because you mentioned unhelpful patterns of behavior that originate often from like early life or childhood. And I think my understanding anyway is that Jung talks about these, but he refers to them as complexes or emotionally charged associations. And like, you know, who among us does not have those? And those two, they did work together. So like, I think a lot of the ideas are shared, even if the language is different.
Well, the language is different, but so they did know each other. I think Jung was slightly younger than Freud.
Stop
it. But they both advocated analysis for the treatment of mental illness. So this was the start of the development of analysis being used. So rather than the biomedical model of essentially psychiatric disorders originate in the physical area of the brain, and they have to be treated with medication, and even that was really primitive at that stage.
Okay, what time period are we talking here?
So 1900,
right?
Around 19, both sides of that,
right?
They worked and trained, and
that's so crazy. Like to think about that is so crazy because I think of when I think of medical treatment in that time, I'm thinking of like cocaine, leeches.
Funny you should mention that. Freud loved a bit of cocaine.
Really?
Well, yeah, at that time,
I didn't know
cocaine was like
medicinal.
Yeah, it was all like Marty does this joke about, oh, you've got ghosts in your blood. You should do cocaine about it. Well, the army was using cocaine, and it was like, this is a wonder drug. It means our soldiers can like fight for 3 days straight. And Freud got wind of this and started treating everybody, including himself, with cocaine. And then one of his associates, who was addicted to opium at the time, he was like, you should use this cocaine to get off the opium. But then the guy got addicted to cocaine, and Freud was like, I probably shouldn't use cocaine too much. So he just used it occasionally after that.
Cool. That's way chill.
I know.
They don't mention that in the Freud Museum.
I know, a lot of the stories are kind of a bit like that. So anyway, so initially when they first met, they loved each other, and they apparently talked for like 12 hours straight, and they were like, this is the only man I've ever met who can, you know, understand me at this level or whatever. I can't remember who said that, but they were like, great.
Probably felt that.
But soon their ideas started to separate. So Freud was primarily a materialist, and Jung was more interested in the unconscious in terms of connections with mysticism a little bit. Like, so Jung believed that the unconscious, when we access the unconscious, we're not just accessing our own unconscious, but like a collective unconscious and an ancestral unconscious. And Freud did not follow him with that idea.
Okay.
And also Freud very often associated the energy of the psyche being blocked for some sexual reason.
Yeah, he was all about sex,
He
wasn't
was
he?
obsessed with sex, and he also had some interpretations about like the infant sexuality.
Yeah.
You know, and Jung was like, I'm not sure about that at all. You know, I don't know. I think you're just obsessed with sex, Freud. Another funny story is that so Freud's wife Martha had a sister. Oh, it was like Minna or something she was called, and her fiance died, and she came to live with the Freuds. And whether there was any truth in this or not, but Jung spread the rumor that Freud was having an affair with her.
Mm-hmm.
And I just love the kind of, you know, daft
What
behind
drama?
the scenes drama that was
Well,
going
I
on in
mean,
psychoanalysis at the time.
Probably
you know,
not that outrageous an assumption, considering he was really into sex.
I know. Apparently, some historians have sort of felt that they could verify that he did indeed have an affair with her based on his correspondence around a particular time and the trip that they took to Italy or something like that. And
But just him and his wife's sister?
yeah, him and his wife's sister, yeah.
I mean, okay.
So, you know, who knows? But anyway, so today some people can be really scathing about Freudian psychotherapy.
Yeah.
Psychologists in particular feel that given the scientific advances in what we know about the mind, that it is very outdated. A lot of the ideas are very outdated. However, I feel there's a lot to be said about early experience and the influence of early experience, patterns of behaviour, internalizations about what our value and worth is that come from those early days. And of course attachment, which we are going to get into big time on another
I can't
episode
wait to get
for
into
sure.
big time attachment time. Okay, yes. So I also think this is a good time to mention that in order to come back to the point of this whole podcast, which
Yes,
is to
please do that.
destigmatize,
Thank you.
etc., that in order to attend therapy and like benefit from it, you do not have to give a shit about Freud or Jung.
No,
or
you
any of
don't.
that stuff that we just talked about. We are just super nerds about that and love it. It's like
Yeah.
scandal time, and also it's interesting to read. But you do not need to know like theories about the mind, subconscious, all that stuff. What is more important than all that stuff is going into the experience of therapy with like an open mind, open heart, building like a trusting relationship with your therapist. And then if you want into that stuff, there is space there for you to do so. Like we love that kind of thing because we're like in literature and, you know, talking about psychology in a nerdy kind of way. And
Yeah.
I like reading about dreams and subconscious stuff and
Yeah.
like spirituality, like you mentioned, is kind of stuff that you'd get into if you were reading about Jung, but that's only developed. I think it's worth saying for our listeners who might be being like, right, okay, we get it. You love books. For me, that's only developed in like the past couple of years of therapy, because in the beginning of me attending therapy, it was like, hi, I need help today. Can you help me be less mental? Like, also don't make it super complicated. Just fix me, basically.
Yeah.
So if she had been like, have you heard of Jung's theory of individuation? I would have been like, bye, I'm going to go to hospital.
Yeah.
So the point of all of that is to say,
Yeah.
it could be that kind of chat early on could be alienating, but it is worth mentioning just to give kind of like an idea of the scale of depth that is available with the many types of therapy that are out there. You are the client, and like a good therapist won't start making you read difficult theory or listen to them talk about stuff like that, unless you're kind of going, hey, you know, is there can I do reading, or like what's a good thing to look up for this kind of thing? So yeah, just wanted to get in there with the disclaimers.
No, thank you very much for doing that. And I should also
right, nerdiness.
I should make a disclaimer as well to say I'm absolutely by no means first of all, I'm not a psychotherapist. I don't have training in psychotherapy. I have an interest in psychotherapy, which goes alongside psychological knowledge, counselling knowledge, and knowledge of the field in general, you know?
Yeah.
And we do have to be careful that we don't become a thanks psychotherapy podcast, you know? Other types of
true.
therapy are available. That's the disclaimer.
Yes. Please.
And also, just to reiterate, you definitely don't need to know what these old white dudes were all about.
Yeah, there's a lot of old white dudes.
There's always a lot of old white dudes. No, you don't need to know that. It's not a prerequisite for getting benefit out of the process at all. I suppose that we're just still discovering what this podcast is about. And it's an organic process for us as much as it is. And it's similar to the process of therapy, and
Oh
it's
my
similar.
God.
Yeah, it echoes it. It does echo it. And I think we're making a podcast that we ourselves would be interested in, presuming that there are other people out there who are like us.
Please, God, let there be some other people.
Fingers crossed.
Otherwise, this will be a massive embarrassment. I don't think that's going to be the case.
It'd be yeah. So just to go back to what kind of therapy you might encounter out in the world, thanks for drawing us back to the point there when, I was getting off into drama between psychotherapists. So for example, what I would see as kind of the polar opposite of psychotherapy is CBT.
You're calling that's a big statement. Polar opposite.
Well, I suppose because it's cognitive behavioral therapy. So it's where analysis is thinking about feelings and unconscious motivations.
Mm-hmm.
Thinking about cognitive behavioral therapy, essentially what it's looking at is the unhelpful thinking patterns. So its whole theory base is that your thoughts control your behaviors and your feelings. So if you can correct the thoughts, the unhelpful thinking patterns, and the learned patterns of behavior, then you can impact the emotional aspect of things. So it doesn't focus on the emotional part. It doesn't focus on the feelings necessarily. It focuses on the product of the feelings.
Yeah.
And so, I think we have kind of low-key slagged off CBT a little bit on this podcast so far, only because you didn't have a brilliant experience with it and it wouldn't be our preferred go-to thing. But it is super effective, particularly for anxiety. And did you know that it's among the only evidence-based practices that has bunches of clinical evidence proving that it works and is recommended by NICE. So it's the talking therapy that's recommended by NICE. And that means that basically they tested people before having their therapy and after, and there's a demonstrable effect in enough people to show a significant effect size.
Is that at the end of 12 sessions or whatever? Or?
Yeah, I mean, usually I would say it's 6 or 12 sessions. Mostly it's 12 because 6, I mean,
can't do anything
it's not
in
really
6
going to stick in 6. But I mean, I used to do 6 sessions with a core questionnaire at the start and the end.
Yeah.
And so you do a questionnaire at the start and it gives you a score, and then you do your sessions. Sometimes you do a core questionnaire in the middle.
I remember doing those. I think that was a lot of what I didn't like. I was like, this fucking questionnaire not going to help. I need help here. So I think that was just my experience of it was quite negative.
I think the other thing is that, clinical psychologists use CBT. It's one of the tools in their, tool belt of things that they can bring out to help a person in the room, and they do that because it works, and some criticisms of CBT are that it's a sticking plaster, meaning that it's a temporary solution to a problem, that it's not getting to the root of the problem, it's covering it up. However, there is a benefit to getting someone back to functionality.
Oh God,
and I would say if that's what's available to you and you're anxious, 100% go for it, particularly because it is proven to work for anxiety. Do go for it. But also a lot of people who practice CBT do all the other bits of counselling as well. They do depth work, and they do working with emotions and things like that. So yes, I mean, it has been proven to work, but comparative studies with other types of therapy have shown that it's it is just as effective as other therapies, but it is easier to test and show those effect sizes.
Yeah, I was just thinking that as you were talking there. I did not know that CBT was one of the only clinically proven ones.
Yeah.
I'm like shocked by that. I mean, I feel like, this is very much your area to like school us on, because my contributions to this section will just mostly be me giving opinions.
No, I mean,
Because I have not really had positive experiences with CBT. I think I was very much in that sticking plaster category.
yeah, you
But-
didn't feel it was working for you. And I would say
No.
that if you ever engage in therapy and you feel it's not working for you, seek out a different type of therapy, or sometimes it's the therapist. You know,
Yeah.
relationships don't always work and you don't always gel with each person. Don't see that as a reason why you can't try therapy again.
Yeah, totally.
Actually see it as a reason that you need to keep trying to find the right one. I promise you, you'll be surprised.
Yes, I definitely agree. I can think of maybe 3 or 4 people I went to one session with, and I was like, I just don't like you. I'm so
Yeah.
sorry. There's nothing wrong. I remember one woman emailing me and being like, sorry to hear you're not coming back. Is there anything I could have done differently? I think she was in training, and I was just like, I didn't reply. I feel bad about it. I still think about it, because I'm like, I just didn't like your whole thing. I'm so sorry. So, I mean, yeah, don't feel bad, I guess, is my point there.
Yeah, don't feel bad. And if you are a trainee therapist, or a practicing therapist currently, you might know, like me, that there are situations where you feel like, God, that person really didn't like me. That was like they
Do you have
attended
that
for.
feeling?
I've had a couple of people who have
Oh.
who felt that I was not helpful to them and
Yeah.
were vocal about me being not helpful to them.
Okay.
And the thing is I wasn't doing anything differently with them than I was doing with other people. So you balance it by feeling this is about their journey.
Mhm.
You know, it's not, but especially when you're in training or in a very small country like our own.
Yes. Yeah.
Actually 2 of those people, I mean, there's really not that many, just so before people worry that I'm a terrible therapist, but I'm actually not a therapist anyway. I don't use that term because it's
You're a counsellor, right?
I'm well, yeah, I am a counsellor, but
You have been.
I have been a counsellor. I'm going to use the term practitioner, I think, at the minute,
I like that.
because so I'm a research psychologist primarily,
Mhm.
but I have counselling training, and I'm in the process of registering with the British Psychological Society, and then I'll be a registered psychologist. So essentially, if I was to carry on doing some counselling work with people, I would be a practitioner psychologist.
Okay.
All of the reason why you have to be careful with this is these terms are protected. You
Right.
can't just throw around a term. You can't just say I'm a therapist if you're not. I mean, therapist generally we mean psychotherapist. That's
Right.
what we
Yeah,
mean by
that's
that
my
term.
understanding of it. Yeah.
Yeah. So trained in some form of psychotherapy, whether that be art therapy, traditional psychotherapy, psychoanalysis, Jungian therapy, whereas other people, I wouldn't expect a counsellor to call themselves a therapist, and I would be a wee bit precious about that.
Okay, I get that.
And
Makes
I've lost where I was going with that now. But so basically, it turned out the 2 of those people who had felt that I was not super helpful, I actually know them in a roundabout way.
Oh,
Like
shit.
I know someone who knows them,
Okay.
and I have been in their presence at like gatherings,
No.
which is, can be sort of awkward.
It's an ethical minefield.
It's a little bit difficult.
What was your training in initially?
So my training was in person-centered counselling.
Yeah. Can I interrupt and be like,
Yeah.
is that Carl Rogers?
It is Carl Rogers, yeah.
So I like when I know a wee something. I know something.
You know loads.
I know some things. Sometimes.
So that was originated by Carl Rogers, and it was actually a reaction to psychoanalysis at the time. He took against, for example, the thing that we were talking about earlier about the therapist being a blank slate, so sitting
Yes.
behind the person silently, not responding to what they were saying, responding very little, and also that the therapist took an expert position, and clients were called patients at that time, and Rogers wanted to move more towards a humanistic way. It's literally humanistic psychology, and humanistic counselling is where it comes from, and that puts the client as the expert in the experience, and
that's nice.
the counsellor then becomes a mirror, so reflects to the person what they are bringing into the room.
Okay.
And that's to deepen people's understanding of their experience. And he believed that there were 3 core conditions that needed to be present for therapy to be effective, and they are empathy, unconditional positive regard, and congruence.
Oh, I didn't realize that was him. Unconditional positive regard. I like have that as my sort of personal mantra.
Yeah.
To keep me being a nice person in life. I try to.
Yeah.
I didn't realize it was him.
Well,
I thought it was just a.
Since I trained in person-centered therapy, I have integrated a number of other techniques into my practice.
Okay.
I don't think there's anybody really is purely person-centered practitioner anymore, but those core conditions, they, continue, because essentially what they describe is the process of making a quality therapeutic relationship. Those are the conditions that allow for therapeutic relationship to happen.
Okay.
So for example,
so congruence was the third one?
Yeah, so congruence is basically, the literal definition of congruence is that you're the same inside as you are outside.
Right.
So it's like honesty, but more than that.
Yeah.
So essentially it's being really yourself in the relationship, right? So the person can trust you because you are coming into the room and you're being like, hello, here we are.
You're talking about as a practitioner.
I'm meeting you as a practitioner.
Yeah.
And I am myself. And what you're hearing from my mouth and seeing on my face is to do with what's going on inside me.
Okay.
And that is easy for me because I'm quite a congruent person anyway. So, but I just admire that characteristic as well.
Yeah.
You can tell the difference between a congruent person and an incongruent person, because a congruent person, you'll find it easy to get on with them and you'll feel like you know what they're about.
Okay.
Do you know what I mean? You'll be like, I know what they're about. And somebody who's not congruent, you'll be like, what's going on with them? I feel confused, and I feel like sometimes they don't say what they mean and stuff like that. And then unconditional positive regard is essentially going in without feeling that you're going to judge the person, that they are, by being a person, they're inherently valuable and worthy of attention, and that their feelings should be heard, and their needs should be heard, and all that kind of thing.
Okay. And
then empathy is seeking to understand another person's experience.
Yeah.
And express it to them as well, because I think empathy is an action. It's not just a feeling, really. Empathy should be an action.
That all sounds super chill.
It is great, but I have integrated other things into my practice. Like I worked with brief solution focused therapy for a long time in that kind of 6-12 session model, which while it is quick, it doesn't mean that you can't do something productive during that time. And it can be helpful for people to have goals and set goals and things like that. And some CBT tools can be useful just in terms of challenging critical thinking errors and things like that.
Yeah.
And then some psychodynamic techniques as well that you could bring in. I did a little bit of art therapy with a client who happened to be an artist, just because it was suitable for her, because she was an artist. And that was lovely, So basically, the important part about those core conditions, because they have been adopted by many other modalities, is that the therapy relationship is key. So when I was mentioning about CBT being evidence-based and there being a large amount of data to indicate its efficacy. When there have been comparison studies that have looked at CBT versus psychodynamic versus counselling versus whatever,
Okay, yeah.
what they found is something called the equivalency paradox. And essentially what it means is that all of the types of therapy are beneficial.
Okay.
Really, there's not a wild difference between different types of therapy. I think the process itself is helpful rather than not. The data is sort of suggesting that different techniques are equally useful.
Okay, yeah. Is that the, like, you know, I've read a little bit, like, when they're talking about the efficacy of different you know, practices, or what's the word? Modalities. I love that word. The efficacy of different modalities. The question of better than nothing. Is it better than doing nothing? I.e., is it not harmful?
Yeah.
And I find that interesting. When I first saw it, I was like, oh, that sounds a bit shit, to be honest. Like, better than nothing makes it sound not that impressive.
Well, I think what they're trying to do is compare it with nothing.
Yeah,
I mean,
doing nothing.
One of the other difficulties with counselling efficacy studies is that the control group has to not have counselling. If you're doing okay, is it better if they get counselling or don't get counselling?
Okay.
And very often you have to use a waiting list in order to achieve that. So you have a waiting list control group, because otherwise you're basically stopping people having counselling.
Yeah.
And it's just not
That's
ethical,
no
you know.
good.
It's an ethical minefield.
I mean,
but the bottom line is that the therapy relationship is key.
regardless of
regardless
modality.
And so sometimes a relationship won't work because your personalities don't gel, or you just, you know, the person, you're not vibing with the person,
All
right?
about vibes.
But a good therapy relationship is going to bring benefits to you regardless of the modality.
Yeah. I mean, this kind of goes back to what we said in the first episode. I vaguely remember talking about that's the fundamental rule is largely about the relationship, isn't it?
Yeah. Well, the fundamental
Actually
rule
can't
is that you
remember.
have to be totally honest
Honest.
when you go into the room. But yes, I do think we did talk about this. I hope we're not repeating ourselves too much, because we can't really remember it now.
You tell us. But yeah, I love talking about the therapy relationship. Like, I think that is fundamental, because like you can search far and wide for like a really specific practitioner or therapist or group or whatever, but none of that is really as significant as feeling safe to like express yourself in the session or whatever the session might look like. I actually just realized that I have done other therapies that I forgot to mention at the start, or like therapy adjacent stuff.
Okay.
That I didn't spring to mind initially. For example, group work.
Oh.
I have engaged with group work, and I would love to do it more. Like, it can be, I think it's quite daunting, and it's funny that we haven't brought it up yet.
Yeah.
Groups, we haven't mentioned group therapy at all. But
if my dad was here, we would have been talking all about groups.
This would be a podcast all about group therapy. I used to know someone who we were discussing it, and she had attended group therapy, and she said they call it the Hall of Mirrors.
Oh.
And I was like, oh my God.
Earth.
In a good way. I was like, shit, sign me up. But I have attended Al-Anon, which, for anyone who doesn't know, Al-Anon is like a wing of AA, basically, and it's for people who are not in active addiction but have had any kind of family relationship or romantic relationship or any relationship of any kind with an addict, and they feel it has affected their lives. And it does follow that 12-step format that people know about from AA.
Yeah.
Why did I bring that up? Oh yeah, the reason I mention this is because, again, those groups are largely about the dynamic between the attendees, and it can be massive. Like, as I say, I've dipped in and out. I've never really properly done the steps, which you're encouraged to do at some point, or at least consider engaging with them. But I guess they provide structure to the group sessions.
Yeah.
But it can be incredibly impactful, just
Yeah.
as a sort of short-term engagement or whatever. like there's no nobody's there to like provide therapy to the rest of the group, and there's no like leader necessarily.
Yeah.
Like there's no one way support between people who are attending. But I think the thing that makes it so impactful is there's like a mutual understanding between all the group members, that they're coming to like a space where everyone knows what the fuck the deal is, like what's going on, and there's shared experiences, and like a lot of emotional relating goes on.
Absolutely. I think
quite a charged sort of a way. It's very
one of the things that groups of that kind, supportive groups, give you is they reduce isolation. So they make you feel that you're not alone. So it can be a very lonely experience. I'm the only one suffering this way. So they reduce your isolation for a start, and then they give you the mutual peer support of somebody that understands entirely where you're coming from.
Oh my god, yeah, that's huge.
I heard a lot of clients mention that sense of they know what you're going through, whether it be a bereavement support group, a depression support group, or an AA group in itself. Going to those things and being like, it's just hard, and having everybody else in the circle nod their head.
I guess it's not better or worse than therapy. They're different things. But the good thing about those group experiences that I've had anyway is you do not have to go in and explain your situation. It's implied by you turning up.
Yeah.
Like, I've typed this into Google, this very specific problem.
Yeah.
And I found this weird community centre that I'm now in, drinking weird tea and eating steel biscuits, and it's great.
Yeah.
And you kind of leave being like, right, that was, it can be brutal, but like, it's very good. So I guess it's like, I bring it up because it's not therapy, but it's therapeutic in a sense.
And there are a lot of different therapeutic things that people can try. What I was thinking about before you started talking about that was that anybody who's seeking therapy for the first time, maybe go for something free, like maybe go to
that's the other thing. Those are free.
Go to like a local charity or voluntary organisation. You might be on the waiting list for a few weeks, but usually they'll give you an assessment session quite quickly. And then they'll maybe give you 6 sessions after that, or maybe more.
Yeah.
Usually the counsellors themselves will try to push for you to have more sessions if you feel you need it. It's free. It allows you to try it out, but also don't be disappointed if you don't get on with the person. Seek out another organisation, or go to your GP. Just keep trying, keep plugging.
Yeah, man.
And so, any other types of therapy that you're hiding, that you're sitting on there, Hannah?
Yes, I have a big one. EMDR. I have done quite a bit of EMDR within my current therapy, because my current therapist also practices EMDR.
Yeah.
Here comes the section of the podcast where I read directly from Wikipedia and other websites.
No, that's good, because this is a complicated
I should cite them, but I wasn't going to freeform this. So the acronym EMDR stands for eye movement, desensitization and reprocessing. And it's usually referred to simply as EMDR or EMDR therapy.
Yeah.
And it's a form of psychotherapy developed by an American psychologist called Francine Shapiro, who posited that the treatment could be successful in the treatment of PTSD and depression. And it typically involves the client recalling in as much or as little detail as they want a traumatic memory or an unwanted core belief about themselves or their lives, and talking through the associations that they have with these while a therapist controls bilateral stimulation, sometimes using buzzers to stimulate alternating hands, or more commonly, I guess because it doesn't require equipment, moving their hand rapidly in front of the client's eyes while they quote unquote process.
Mm-hmm.
So that's your little blurb about that. So I have done this therapy, and it's quite hard. Like, it's physically and emotionally draining, but it's worked very well for me.
Yeah.
And I think I kind of view it, I know that people do it as like a session by session, maybe you do like 6 weeks.
Mm-hmm.
I think for me that would be extremely intense.
Yeah.
So I've kind of treated it as like a productive add-on to my overall psychotherapy process.
Yeah.
But it's interesting, like, definitely, if you're interested, Google it.
Yeah. It's one of those ones that I know what it is, really. One of my previous supervisors had trained in it and talked to me about it, so explained what it was, but I don't have any training in it, and I've not had any myself, so you're absolutely the expert on this one.
Well, it's probably worth mentioning that historically it's been a bit controversial in the psychology community.
Yeah.
Um,
Do they think it's woo?
they think it's woo.
Ah.
There's a lot of accusations of woo.
There's
floating
a lot
around.
of that goes on in the psychological
Don't
community.
I know it? Like, for example, while I was putting this together, this little bit of research that I did on EMDR, I was Googling some terms, and you know the way like Google suggests questions underneath your initial search results? One of them was, is the EMDR a hoax? And the answer below from scientificamerican.com was simply yes. No further elaboration.
Wow, okay.
So I did a bit of reading on that. And I think it was kind of clickbaity because they went on to say, you know, there's problems with like, you know, quality of control groups and all this kind of thing. But the basic sort of sense of the article was like, give it a try if you want. We don't believe it at this magazine.
Oh, right, okay.
So that's, you know, that's a thing. Make of that what you will.
Yeah, maybe there's not enough clinical evidence yet to back it up.
I think
My understanding
cold, hard
of
facts wise, people are not convinced. But anecdotally, you know, it's quite popular, I think.
Yeah. My understanding of it was that, you know, trauma therapy in general involves a recall of the traumatic incident with the aim being that you take the power out of the incident. So you take the all the affect out of it, and it becomes matter of fact. So post-traumatic stress disorder, for example, when you have flashbacks and things like that, it's, you know, your nervous system is going right back to that I'm in mortal danger.
You're activated.
Yeah, you're totally activated. And so trauma therapy, my understanding of it was, again, I'm not trained in trauma therapy, but is that the recall of the incident is supposed to take that out of it. And then my understanding of EMDR was essentially hacking the processing unit of your brain.
I think that's maybe part of the problem is the use of language like hacking. Or I saw bypass in another place that I read, and I don't think those are really representative of the of what actually happens, because there's definite processing. I think the eye movement thing is meant to mimic the movement of the eyes in REM sleep, which is where your brain, like, you know, gets little bits of information that it's picked up throughout the day and puts them in their like appropriate folder.
Oh, that's adorable image. I love that.
It's amazing. Thanks brains for doing that, because
thank you.
I mean,
brains.
Thank God, that's why we sleep, I guess. But you know, to do that consciously in waking life with another person there who you trust is a different kind of thing.
Yeah.
So, I mean, I'm really not doing anything to discredit the woo thing, but
no,
that's my
I think we have to keep an open mind, really, and that tends to be my philosophy with things. Like, you know, when we were talking about the Jungian stuff earlier, and I was quite surprised to hear about the divination type stuff that Jungian therapists would use, like using the tarot, or as Americans say, the tarot. Well, I think we might have just got into saying the tarot, and we could be wrong, you know, I don't know. And so, and the I Chi, which I don't even know what it is, you throw the I Chi, I think it's like runes of a kind of type.
I've seen that.
Because, and why I'm open-minded about that, because I tend to be a materialist, you know, I'm a scientist, and I'm a research scientist, and that's where I've always been, you know, very much down that line.
You don't really engage when I talk about zodiac stuff, I've noticed that.
No, I don't at all.
Noted. We will keep that for the zodiac episode.
But I do keep an open mind about that kind of thing, because I feel like, firstly, I think archetypes are useful, because the tarot essentially is a lot of archetypal images that we can use to find a greater understanding of ourselves and of humanity.
Yeah.
And
it's cool.
Those type of add-ons, spiritual type add-ons, or you know, stuff like sand tray, or even play therapy. So I had a workshop in play therapy, 1 day workshop in play therapy, and it was a very affecting experience. and it was for more than just me in the room. So we started out in group circle. And the point of the play therapy was that we were going to do some play therapy exercises ourselves as a way of experiencing what you might do.
Yeah.
And within about, I would say, 10 minutes of us being in the room and starting to talk, there was at least one person in tears.
Oh, yeah.
Right? We did an exercise where we visualized ourselves as a rose bush, and then we drew the picture
Oh my God,
of
I remember
ourselves.
you telling me
I
about
still
this
have
afterwards.
the picture. We did clay work, and we did, work with little toys, and I found it deeply, deeply affecting. And it's one of those things that you don't quite know what's happening, or that anything is happening while you're doing it. So I would always keep an open mind about those things.
I mean, you can tell even from the way we're talking about it, you can see why it's hard to measure scientifically those kinds of practices.
And the danger is that if you don't provide the figures of your efficacy, you don't get the funding, because the people who control the funding just want cold hard facts. And we're in danger of losing things if we don't, create a little bit more nuance in that particular argument.
True.
I mean, one of the things that we are doing with talking about these few, because we really have touched on a few types of counselling and psychotherapy and therapy in general today, is the type of things that would be available to you if you went looking for therapy in normal, just everyday kind of life.
Yeah.
In this country, there's probably not as wide a range of types of therapy as there are in some other countries, and that's because we're a small country and we don't have masses of training.
No,
there's not good routes. We've talked about this in recent times, actually, regarding your want to train in psychotherapy, and there's not a wide range of training courses that you can't just be like, oh, I'm going to go to the psychotherapy training over here. Oh no, I want to be a Jungian analyst. I'm going to go to this one over here. It just doesn't exist. You have to go somewhere else.
Yeah, it's a shame.
Yeah. And so sometimes you have to go across the water, as we say here, to the mainland.
The mainland?
Or sometimes you can go down south, is the other thing.
Yeah.
Because it's a bigger country and, they have a few more things. And one of the main routes that we have, if you want to be a counsellor, you want to just help people and you just want to go and be a counsellor, is there's an undergraduate degree in counselling which is delivered by the colleges here, the regional colleges. So there's several regional colleges. I think it's a 2 or 3 year degree, I can't remember. And so that is training people in integrative counselling.
Okay.
Very often when you look up the counselling directory, certainly this is specific to the UK, I would say, more than maybe internationally, but you will see integrative counsellor on what they're trained in, right? And basically what that means is they will go for counselling training, and there will be a basis in maybe humanistic counselling, and then there will be CBT, and there will be some psychodynamic therapy, and there will be a lot of different modalities integrated into their training so that they can draw on a lot of different tools and techniques.
Cool.
And so that's what a lot of people are training in this country now, certainly. So if you see that, that's what that means, basically. It doesn't mean that they're going to integrate you, although hopefully they will. It means that their practice has a lot lot of different modalities and tools that it can draw upon.
Yeah, that's actually
that's
good to know. That's good to know. You've explained that, because for someone listening to this podcast being like, well, I'm not trying to be a counsellor, so don't tell me about the colleges, but that is kind of good to know, because I would say that that's going to be needed in Northern Ireland.
Oh, definitely. I mean, the more people trained in any kind of therapeutic technique, the better, as far as I'm concerned. The other thing that psychologists have done to open up that area, so without having to either get a clinical psychology doctorate or do a PhD or something like that, if you have a psychology degree and you maybe have some counselling, and you can apply to become a psychological well-being practitioner or something. Like there's some specific title that they have, which is, again, it's to improve the access to people having, you know, some kind of psychological assistance of some kind. And yet, essentially, the point of all of that is that to give you an idea of what those terms mean when you go looking for therapy. Don't be scared of the terms. Don't be weirded out by it.
Yeah.
Generally, you'll come across 3 things, and that they will be integrative, just the word counselling. I'm going to say 4 things now. CBT or psychotherapy. And all of those are fine. It really depends on what you want out of your session, and also give them a try.
Yeah.
Just probably don't launch straight into something that's quite out there and intense for your first experience of
that's
engaging in
good
counselling.
Advice for anything, really.
Oh, definitely, yeah. So does that feel like a good time to go to our agony aunt corner?
Let's solve some problems for someone.
Okay.
I have this week's problem ready to read to you, Emso. You ready? This is from anonymous young male, mid-20s, and he writes, "Hi, my question is about my relationship with my mother.
Oh.
My siblings and I have all left home and are living relatively normal lives with partners, kids, careers of our own, etc. But when I speak to my mother, I find myself wondering if she wishes we were all more quote-unquote traditional. She herself is not necessarily conservative, but I do find myself worrying that she misses out on the best moments of her children's successes, and especially her grandchildren, because she is lamenting the fact that we have, in her eyes, taken less traditional paths. For example, having children out of wedlock. How do I broach this with her without widening the generational gap between us or possibly making things worse?"
Oh.
It's quite a biggie, I think.
That's a big one.
That's
It
big.
really is.
Thank you for writing that question and for your candor.
Thank you so much for that. So this is sort of my area, which instantly makes me feel, worried about approaching this. Well, it's much easier when you feel kind of unqualified and you can sort of say, but parental relationships and family relationships is what I did my PhD in, so it's sort of my area, yeah. And the very, very first thing that strikes me is, wonder what is going on for the mum, really. Because she's trying to communicate something which he is very lovely picking up on, that she's dissatisfied in some way.
Yeah.
And I wonder what it is she's trying to communicate. So he feels that she is not enjoying her children and her grandchildren because she's disappointed that they didn't get married before having children. Is that what?
I think that's that's what I pick up from it, that she I don't know, is focusing on that more than just kind of being present.
Right, okay.
Being in the moment and, enjoying. It mentions that she's had her first grandchild.
Okay.
So I think the relationship with the grandchild is
maybe...
the
first grandchild?
It's the first grandchild.
Right, okay.
I edited down the letter because it was long. But yeah, it's the first grandchild. That I should have kept that in. It's significant detail.
Okay.
And that child has been born out of wedlock, which seems to be a sticking point for her.
Well, I do have some advice for this writer-inner. Is that the term, writer-inner?
Yeah.
So, whenever somebody has traditional values like this, essentially what they're doing is this parent is literally in her critical parent. So she is reflecting the disapproval that she feels about this. And it can be hard whenever you're wanting to reflect that disapproval because you want to correct the children. The children have done something wrong.
Yeah.
You want to correct them. So if you're in your critical parent, you're saying, no, that's no good. It's not good. And you're, it's a very stuck place to be. However, usually when people, no matter how traditional they are, when the little child comes along, the little baby, they soften their position based on the baby being present and faultless and
Sure.
existing, and because of their desire to enjoy. Now, this
Yeah.
is only the first grandchild and it has just arrived. So time can be given for that adjustment to take place. And also that person, that mum, can be cajoled and encouraged and maybe flattered slightly
Mm-hmm.
into shifting her position from one of critical, wanting to disapprove, to a softer position of wanting to nurture and enjoy this grandchild. That absolutely can happen and can be done with a caring, careful and quite pleasant way with the people. This has happened in our family, Hans.
Oh yeah? Do tell.
On more than one occasion it has happened. None of my grandparents are still alive. They all died when I was in my teens and early 20s, because I'm the youngest of my family. So my grandparents were really quite elderly already when I was born.
Yes.
But all my siblings were older, and none of them really felt that marriage was the priority before having children. Not a one of them really cared about that.
No.
But of course, the older generation, that was difficult for them.
Mm-hmm.
So, Granda Samaritans,
Yes.
for example, he was unhappy with
my mother
your conception.
and me being a bastard.
She has to say it.
I have to say it.
So he was unhappy with that,
Okay,
but he softened as soon as he met you.
Because I was very cute by all accounts.
He had the most enormous eyes known to any other human that had ever been born. But yeah, no, he softened when he met you. And
yeah, that's interesting. That I mean, who can? It's hard to criticize a baby.
Well, you can't. They're faultless.
So cute.
They're not at fault.
Yeah.
And because he was so fond of your mum, you see, so he was disappointed in her. And it's just those traditional values are they're ingrained in that person. You know, it's not really their fault either. It's been ingrained in them. So, and I mean, he softened very quickly. He's like, well, she's here now, so she's
So lovely. I wonder, will that happen for our writer inner? I
think it will, but my advice would be that you can absolutely encourage that, and I would say that flattery goes a long way. Just to smoothing over those rough edges there. Just gentle handling and flattery. Oh, here's Granny. Granny, do you want to be nurse?
Yeah. And I guess we're talking mostly about there's baby, mother of that baby, and then the grandmother who's the subject of this letter. It's her first time being a grandparent. So that's a new experience.
Yeah.
And I think maybe that experience gets not discussed as much because it's all about the new mother and, a new niece or nephew in the family.
Yes.
And, just because you're older doesn't mean you know everything that's going on.
No, that's true.
Is my
guess. And, I mean, because there's so little detail, I'm hoping for the best outcome. I'm an eternal optimist, and I'm hoping that there's not more complicated things, but often there is more complicated things. For example, new mothers are like tiger mothers. They're very possessive of their babies, and it's entirely natural that they should be. One of the things that's traditional in our culture to do is when a mother has a baby, tons of family crash in on the house or even on the hospital, and the baby is handed round. Everybody gets a hold of the baby.
That sounds, I mean, I can imagine that for a new mother, they're like, stop it. Get away.
Yes, they can be. I mean, I think initially there's a kind of a, yes, hold the baby. Her eyes are following the baby around the room. Get the baby back to me. Thank you very much. Bye. I'll be getting on with my life now. But after a while, it can feel, especially when the hormones really start to kick in, that bonding is getting really, really strong. It's contrary to your instincts to constantly be handing the baby over to somebody. And the person that often wants the baby more than anybody else, including daddy, is Granny.
Wow.
And so that can bring a lot of tension. So it could be that Granny, especially if she's indicated some disapproval,
Yes.
that will have put her in the bad books a little bit.
Mm-hmm.
And if she's feeling in the bad books and also disapproving, she's adopting an attitude that's not really conducive to good relations between all these people who are just going through one of the most major life changes that you can go through in your,
God, yeah, that's a really good point, actually.
So mother-in-laws and grannies in general can put their foot in it. Absolutely, it is actually and not a very talked about but a delicate relational situation there.
Yeah. I mean, mother and daughter relationships anyway, without the addition of a baby, are, shall we say, intense. So that's kind of a major area.
I would be interested to know what relationship this is. So is this her daughter who has had a baby out of wedlock?
Yes,
or
it's the
is
daughter. So it's the writer inner's sibling, I assume sister.
Oh, right, okay.
And
So
they share a mother.
Okay, well then whatever disagreements happen will be resolved, because ultimately the daughter will turn to her mother in this new motherhood world.
Regardless of previous tensions.
Yeah, I mean ultimately they'll turn back, provided her behaviour falls within normal boundaries, but within normal realms of behaviour, and if everybody tries to smooth things over and that's everybody's aim, this writer wants to help the mother enjoy things more.
It sounds very much like they want this to be resolved between the siblings and the mother.
Yeah.
And they're worried. They actually say, I find myself worrying that she misses out.
Yeah.
So he's worried about a loss for her. Yeah. He's kind of saying, you're so in the critical that you're not enjoying this thing that you should be enjoying.
Yeah.
And that he doesn't want that for her. So there's care in there, which is nice.
Well, I would just say,
like, my mum's a bitch. What can I do?
No, carry on with the care and just lay it on really thick, If it's a very emotional time for people, it really is. And so I think treading delicately and approaching with kindness. I think I might have said kindness to the last problem.
Aw, it's nice.
That's gonna be my buzz term.
That's good. I mean, of all the buzzwords to use, like,
approach with kindness, yeah.
That's lovely. That was very good. You're the right person to ask that question.
Yeah, unfortunately it's my area, so I felt a wee bit put on the spot.
I like bringing the questions in because I'm just like, Emma, what do you think?
Maybe we should always do it that way. But then, so what we're hoping is, and we will put this appeal out again, is we're hoping that you will send us your questions to our email address, which is thankstherapy@gmail.com.
Yes.
Or you can find us on Twitter, just at Thanks Therapy Pod, I think. Or is it at Thanks Therapy Podcast?
I can't remember. I think it's pod.
You can search that up on Twitter and I think you'll find us.
Yeah.
But we'll put links actually as well in the show notes. Please do send us your low stakes anonymous problems for us to muse about.
We will anonymize them.
Yes.
As much as you want as well.
We will indeed. So I think that's pretty much us, Hannah. I think we've talked about all we have to talk about.
Yeah, I love talking.
I do like talking as well. I love talking. Which is lucky.
That's why we have a podcast.
Got a podcast now, so we have to do all the talking. Okay, thank you, Hannah.
Thank you, Emma.
Thanks, therapy. For example, clinical psychologists practice CBT. It's one of the main, not one of the main, but it's one of the toolkits in their armory sort of thing.
Yeah.
I'm going to say that again because toolkits in their armory is a nuts thing to say. Clinical psychologists use CBT because it's one of the tools in their arsenal, essentially.
Are you happy with arsenal?
It's one of the tools in their toolkit.
I say it's one of the tools in their belt.
Yeah.